sure the animal's negative, we'll draw a little blood out of their leg usually.
And it doesn't hurt.
No, little blood.
No, we
Some
all know
dogs make a
that.
big fuss, but
No,
it's
I
no
know,
big deal.
no.
She's pretty good about that stuff.
You know, I know one day we talked about heartworm in cats, that it's not very often.
Well, you
but
know,
there's been
they've been finding more and
cases.
more of it, and it's a nasty one because the heartworm in cats, it's not actually easy to find. We can do a blood test, but we don't do it routinely at this moment. We may be changing as we find out more and more, but there's not subtle signs. Many times what happens with the cats is they just have sudden death. They're walking along, they start gagging, choking, they just collapse and die. If an autopsy is not done, we would not know that the animal died of heartworm. It's most prevalent, obviously, in the outside cats. It's spread by mosquito, just like with dogs. But it's a lot. It only takes 1 or 2 worms to really, you know, they're small little hearts compared to a heart like this guy.
Right, exactly.
Which actually is a good lead-in.
So do they have a shot for cats?
No, there was
Not
a
yet.
good lead-in. I hadn't gone through the last product we're using these days. This is the Heart
okay.
Guard that does heartworm rounds and hooks, but does nothing for any parasites. So that one's been not being as used as much because it only has the heartworm prevention. It's a good product, best chewy
Right.
on the market.
Okay.
But there's a new one that's come out called, what else? Revolution.
Revolution.
I'm sure they're having this all over the place on TV right now as the Pfizer
You know,
companies.
we see so many ads in magazines
just
and
stay right
in magazines and on the television with all these new drug products for animals.
Well, this
and
is a neat one. I mean,
people, so-
it was implied that it would be God's gift to veterinary medicine. Unfortunately, FDA hasn't quite agreed. They have not gotten through all the clearance that they were supposed to have as of date. But it's a neat thing. It's another.
But it's on the market.
It's on the market. It's out. It's legal. It's cleared for many things. Initially, when it was being developed, there was rumors that this spot on it's the same kind of. I won't take it out, but these are the little
Like a
tubes,
little vial.
the little vials, like the Advantage of the front line, and you just kind of put it on the back of the dog's neck once a month. And this was supposed to be able to prevent all major intestinal worms, heartworm,
Oh, wow.
fleas, ear mites, sarcoptic mange. I mean, it's kind of like this one product, ticks too. We're supposed to be able to do everything. Now the kicker's they've gotten the clearance from the FDA for one tick, but not all the ticks, which
So there's different types of ticks?
yes, there's several species. I've always thought that one product that killed one tick would kill them all, but the FDA disagrees at this moment. So they're still kind of struggling through it. We've got some in stock. We're using it. It's been working. Actually, what's been working wonderful is in cats. It does fleas well. It does ear mites as well. We've had
This Revolution?
this Revolution, a cat or a dog. They have different sizes and different strengths. And what they just do, you just spot it right on the cat. Where we've had a lot of problems at East Boston Animal Clinic is we've had people have like 4 cats. And one's sweet, and one's cranky, and one's kind of invisible, running around all the time, and they all have ear mites. So the nice one gets treated, and it gets cured, and then the invisible one is hiding, and she can never find it.
Right, and they can never give them
and
their
so
treatments.
we're basically going along trying to put drops in every day, and it's just not happening. What we're finding is that the cats are getting chronic ear infections. Sometimes they have to have surgery done. The ear gets all swollen full of blood, and you got to open it up and drain it from the shaking their heads so hard. They can scratch raw spots behind it, so it can be a real problem. With the Revolution, it's been working. I've tried it on about 4 or 5 households. It's been. You want it to be a lap dog? You're a little big to be a lap dog. Thank you much for the input. But whatever. Oh God. What we do with the cats, and it's a little easier on a cat than a dog like this, is we've just been spotting it on once a month. And if they're a day early or a day late, like the invisible cat's hiding and won't come out, and you get the other 3, and then you get the 4th one, it's real. In 2 months, I've seen almost everybody's 100% better.
Oh, that's
I've been
amazing.
recommending go 3 months just to be conservative, also because it's a new product, but I've been very, very pleased with it. Also, the nice kicker is that when it just came out in the early, I think it was early winter it came out. It came out around December or so. Is that in the summertime, especially for the outdoor cats, it'll prevent feline heartworm as well as fleas and probably ticks and a lot of intestinal parasites. So they're still arguing a little bit about exactly what it's going to do. Pfizer says everything. The FDA says no. So I've still been pretty much putting most of my dogs on a Sentinel because that's been a proven product.
Right.
It's been working well for fleas by sterilization. It's been working great for the heartworm. I've never had a break in heartworm on it, and intestinal worms. And the other thing I like about the Sentinel is that there's a wonderful guarantee program where if your dog gets heartworm, they'll pay for treatment. If your dog gets fleas, and it's, you know, being a sterilizing agent rather than a killing agent, you'll have dogs get a few fleas here and there. They jump on, they're sterilized, they jump off. But the company Novartis, figuring that the public didn't want to see a flea, put a strong guarantee, and they paid up. I mean, if you're on the Sentinel, the computer has it on record, you just come in, fill in a little "I'm not happy" form, and they'll go ahead and pay for a month's worth of flea, one dose of Advantage, a bottle of flea spray, whatever. And it's nice because I can use whatever I deem best for my patient, and they don't care. They'll kick in for that 1 month's treatment.
Yeah, so this is supposed to work for heartworm. Is that still, when an animal gets heartworm, is that still the treatment like the dog's arsenic? Or do they change that?
Well, we've never, cats are there's no good treatment for cats. There's no treatment cleared for cats. Cats are kind of an experimental thing. Are you comfy yet? And what happens is the cats, they've tried the arsenic, sometimes it works, sometimes there's a toxic reaction. So cats and heartworm are pretty nasty. With dogs, what we used to have to give was intravenous arsenic. That was no fun. Nowadays, there's a new arsenical compound that's given in the lumbar muscles, much less toxic, much easier on the animal's liver and internal organs, although it does sting like a son of a gun and it really hurts when they go home. But it's, you know,
they don't have to stay in the hospital.
We still keep them there for several days to make sure they've got to get the shots timed just right, and by the time you're done with your x-rays and your EKG and your ultrasound, you still got, you know, 5 to, I think Angel was up to 1,000, but you know, why spend $500, $600, $700 if you don't have to?
That's right.
Blood tests, plus that, you know, every dog I've treated, and they've all done well, but boy, they're sore for a week or two. Their lumbar back muscle, they just don't want to walk, and they're poor things. But better than dying of heartworm.
That's right. And you know, so many times we figure, you know, just because every year we get tested and there's nothing wrong with our dog, or luckily they don't have it, there still are a few who do. So it's better to do it and get the test.
I saw last year my first Chihuahua with heartworm.
Oh,
a Chihuahua. I mean, figured a mosquito could practically pick up the dog and fly off with it. It's kind of interesting, actually.
Was he showing signs of being sick?
He was coughing a little bit. Yeah, I mean, just move Taz's around. Taz,
so we can look at your little front side, Taz,
turn around.
Your little back side.
Show you a good side to the camera. Now, sit down, Taz. Now, lay down. There you go. That's a good girl. Stay there. And he was coughing a little bit, but no real obvious signs. And we found that he had been in a kennel. I guess his owner had been sick and just recently adopted, so he hadn't gotten any heartworm pills for several months, and about 5 or 6, and so that was enough to set him off. And you know, we pulled him through it, and so but boy, I'd hate to have this dog in a cage. I'm going to give her pills every month. You know?
I know.
No way.
Well, it's so much easier, even though we have different products. I remember when I had like 4 dogs, and that's when you had heartworm, you had to give each one a pill every day.
That was the old pain. Yes, the old.
Confusing. So now, just to do it the other way, that's so many. You know, people should appreciate that and really.
It's so much easier. And the
oh.
thing, I guess, what I like is that what started off with a pill or a treatment that would just take care of heartworm takes care of so many common everyday problems that we used to have to deal with. It can make, especially older animals, very, very sick. Some of the intestinal parasites would really make a dog suffer. Wicked diarrhea, dehydration. Not so bad in a dog who's 4 or 5 years old like Goofball here, but if you go ahead and have a dog that's 15 years old, just kind of barely hanging even, that's enough to push the scale of life into a negative column, and you got a real problem.
That's right.
I've seen some whipworms and hookworms do some problems to a lot of older animals that I'm just not seeing anymore when the dogs are on the heartworm pills.
And it's amazing because you don't really hear that much about hookworms and whipworms.
I still see them in puppies. Puppies are common. That's where they can be born with roundworms, and we've seen a few cases here and there. We're starting to, I think actually we were getting a little lax with the heartworm medicines working so well. We've been trying to make an effort up at East Boston to check that like we're supposed to, like we used to do with every yearly checkup, check a poop sample. And we found a few that picked up a few worms. The the dogs who are on the Sentinel, they're guaranteed, and then Novartis company has been very good about paying for 2 stool checks, and they'll pay for the treatment, and they've been no problem at all. The other products are not guaranteed at this time, and so people have to pay. Well, actually, like the Harcourt won't get whipworms, which we've been seeing a couple of cases of, but nothing horrible.
And I think that's very important, because I remember a few years ago, my Rottweiler, I had some very nice people taking care of him, and they had an area where, he had walked amongst fecal matter, and even though it was frozen, he still ended up with some worms.
Well, sure.
And,
What they'll do
thing.
is they'll be sitting there, and as they step in the fecal material, they'll go ahead and sniff it, and then they'll get it on their paws, and then they lick their paws, and they got all this little microscopic wormades up in their little pussies, and they go ahead and lick it, and they swallow the eggs, and depending on what parasite it is, either a couple of weeks or a month later, they've got upset stomachs and diarrhea and all the classic signs of a parasite problem.
So every year when we come in for our checkup,
That's right. We want to check a stool sample. We've been trying to do that more, and we'll check the poop sample, make sure there's nothing going on.
That's worth it, because you can tell so much from that. Whereas, people figure if I have an older dog, I don't have to worry about it. But you've been doing a lot more work with older animals. Sometimes when people had older animals years ago, they were afraid to come in with them,
That's been something
that's a scary thing.
That's something.
But I think the older the animal is,
psychology is more important, actually.
It's much more important, I think,
as we're getting these new and improved vaccines and combination shots that will protect the little dogs from getting all kinds of problems. Give us a kiss, you poor little thing. I've been finding animals living longer and doing more. And what our old dog routine checkup is consisting of is drawing a chem screen to check the liver and kidneys, drawing a CBC to check for anemia or white cell, red cell problems, things like that. It's just much more common for us to see older animals and to have to do a little bit more diagnostic workups to make sure they're in tip-top shape. In fact, as we're trying to get our computer geared up to do a better job. As you get a little bit farther along, we end up sending out reminders to go ahead and bring your dog in for a blood test, not just for a rabies shot kind of thing.
Well, I think that's important, because sometimes we forget. Everybody has so much going on in their lives that it's easy to forget something like that.
It's actually very important. I think probably half of the diabetics that we have at East Boston currently were found on routine pre-dental blood tests. When an older dog starts to drink more and urinate more, that's a sign of diabetes, and some people will recognize that and bring them in. Other people are so busy rushing around, and I'd probably be as guilty as the next person.
Right.
I'm going here, I'm going there, and I wouldn't even notice if she was drinking more water. It's like, is the bowl empty? I'll give her some more, no problem. But
you have to look for these little things, and especially when you have an older
or
animal.
when you have an older animal, you just do your blood test once a year like you do your shots and your heartworm pills and everything else, and you find it before it becomes a major problem. You can find early signs of kidney problems, early signs of a liver problem that is something, then we can just change the diet and do better.
I know, because I think you said
Yeah,
every animal, now it's optional, where they have a blood test where they had to have them when they were like 7 years old.
No, it's not
Now they
optional.
do them-
It's
I mean,
not,
now
it's
it's
not optional.
I mean, when they were younger than 7.
Right, okay,
But
at least at our
now,
clinic, and I don't
yeah.
speak for it, but most clinics are in the same, higher quality standard, where we have blood tests available now on site, as I think most vets do, where we can do a quick screen of their kidneys and the liver. For younger dogs, it's not required, because we have to give people a choice to make their own healthcare decisions. But as an older animal, 7 years and over, there's no choice. If we're going to give any kind of a potent drug or an anesthetic agent, the dog has to get a blood test first, yes.
Would you believe, Dr. Sawyers, we had such a good time, and Tazzy is such a
Taz,
good girl,
yes, you're a good girl.
we are out of time.
You're out of time?
But we welcome all of your questions
Well,
and your comments.
And we'll
right?
bring our demo dog back for another appearance. We'll have to clean her ears and clean her teeth. They're nice
Thank
teeth
you.
here. You got good teeth,
Thank
yeah.
you very much, and
Thank
we'll
you.
see you again
Good
on
girl.
Animal Talk.
Say goodbye, Taz. Say goodbye. Huh? What do you think?
She's a good girl. She
What a
did
good
good.
girl. Yeah, she's a good girl,
Oh, she
wasn't
did
she?
good.
She didn't fuss or jump down.
No.
good dog. Taz was a good girl.
The cat's